Namaste, friends. Welcome once again our regular session of Spiritual Doctors for Holistic Health, where we invite different medical doctors having some deep, profound spiritual understanding to share their understanding of spirituality, spiritual aspects of health, spiritual dimension of holistic health. And today we have our old friend, one of the irregularly
regular.
Dr. Chandana, who is a cardiac surgeon from Bangalore, associated with one government hospital.
Sri Jayadeva Hospital.
So she is going to present her understanding, her perspective of combining different sorts of health approach, health practices. Many people have some doubt that if I am taking allopathic medicine, can I take homeopathic medicine or not? So that there are various other doubts. There was recently a 3-day meditation conference at AIMS, and their director of CCARIN, Central Council of Research in Yoga and Naturopathy, and Dr. Raghavendra Rao, he was sharing that among cancer patients, this study is among cancer patients, 30 to 60% patients take some alternative or complementary form of medicine, or among all common cancer patients. And among them, 65% don't tell their allopathic physician that they are taking some other therapeutics. So it's interesting, that data. And Dr. Chandana is going to throw a light why it is happening and why it is happening. So welcome, Dr. Chandana, on your own platform, Spiritual Doctors for Holistic Health.
Thank you so much, Dr. Ranjan. I'm so honored. Good morning, everyone. And it's always a pleasure to be on this platform, because this platform has been like a sort of an informal one where you can express all your views and without inhibitions, without thinking what will the other person think. So I think that kind of a fruitful platform where you can explore so many alternatives, and we are exposed to so many thought processes, like how Dr. Ranjan and Dr. Sandeep have come up with this, platform to kind of have a continued medical education, sort of inculcating all the alternative therapies. So this topic I chose because as a doctor, when I'm sitting in the OPD, when patient comes to me and asks, this has happened many times. So when I am consulting, and giving a consultation and telling them that, you have to go for surgery or something. Sometimes, just 2 weeks back, a patient asked, can I just take up Ayurvedic treatment? So suddenly I was like taken aback. Now, what do I say? Being an allopathic doctor, how do I say? What do I say? And, this one question set forth so many thought processes. So that made me read a few topics on this, and, how to approach when such a clinical scenario occurs to, I'm sure it has occurred to many of us, because a lot of people have awareness about so many alternative therapies, and Google being like, in everyone's hand through their smartphones, they are able to access so many different therapies which are available. They want to explore, they want to see if they can combine, they want to know whether, they can combine 2-3 alternative therapies. So what would an allopathic doctor like us, who is sitting in a government OPD, seeing so many patients, how will you be able to, counsel or talk to them or tell them? So I have just made a small PPT. So I would like to share it with you guys. So how do we blend all these multiple therapies harmoniously? So that's exactly what was running through my mind, and why I chose this topic also, when Dr. Sandeep said, choose something which is there in your mind, like, something which you strongly feel about or strongly want to talk about. So, and here I am talking about it. So at the outset, I would like to say there's no conflict of interest, no disclosures to make, and I'm not taking sides here. So I would like to, share a neutral perspective with the audiences here. So we will begin with a small questionnaire. So there was this Dutch actress and comedian, Sylvia Mellencamp. She died, a few years ago. And they said she died not because, she did not die from breast cancer, but from naturopathy. So if you go and read up about her on internet, they will say that, she refused to have any curative surgery, and that's the reason for death. And there was a delay in the treatment. So, I mean, like the naturopathy was completely blamed on that. So, is it true? And then another instance is that of Steve Jobs. We all know who he is. He's the founder of Apple. And he was diagnosed with neuroendocrine tumor of the pancreas. So, but he, for some reason, he tried to use other modalities of treatment like acupuncture and alternative medicines, like, a different form of diet, which he chose over the regular chemoradiation. So this was again blamed for his death. And we all know that neuroendocrine tumors are difficult to diagnose. They usually, when they're diagnosed, they're already in the late stages. And most often the survival of pancreatic cancers is quite limited. So how justified are we in blaming this death on acupuncture or on cancer cure diet, as they have written on the internet? Similarly, this is a third case. So here, this is a Chinese actress shooting, and she was suffering from lymphoma, and she chose traditional Chinese medicine and acupuncture, which is very well known in their country. There are a lot of practitioners who are, following that. So again, this was blamed for her death. So she died at a very young age. So coming to the next case scenario, this is a real life case scenario which I came across very recently. So there was a 48-year-old patient who was diagnosed with periampullary carcinoma of the pancreas. So he was investigated, and in the hospital one in which he was admitted, surgery was straight away advised. After doing all the investigations thoroughly, it's a reputed hospital, corporate hospital. So they advised surgery. However, they went for a second opinion, and there they were advised chemotherapy 2 cycles followed by surgery. So the dilemma was whom to trust. So you see the various scenarios where, I have presented 4 scenarios. So in all the scenarios, the dilemma is such that either within the same stream, like as in allopathy, like this 4th case, people have a dilemma and they lost trust on, this patient lost trust on both the hospitals, and then came to me and said, what do I do about this? So then I explained to them that, both are right in their own way. So there are, for cancer, it is usually multimodality treatment. And we do recommend surgery in certain cases where we can resect the tumor, and in certain cases where chemotherapy is preferred, and then surgery can be done. So it is, now, why did this trust issue occur? Why did they feel like, there was so much of mistrust? Was there was the communication not adequate from the doctor's side? Or, patient wanted to consult me because they were good family friends, or I don't know, they lost trust in both the hospitals. So now, why is there this mistrust? So either they don't trust allopathy completely. Now, this is the general consensus. If you talk to patients across any OPD, there is some amount of mistrust. They don't know how much to trust the doctors. They always have this kind of fear, whether this person is a good doctor, whether this person is going to mislead me, whether this person is trying to make money out of all this, the diagnosis, or whether they are going to give a wrong diagnosis just to make money. And it runs across in all the OPD. You'll find at least 10% of the patients who are like, confused and want some sort of a solution. So then came the, so now when in the last 4-5 decades, we know that the pharmac industry came up with many good drugs. I wouldn't say that, despite the side effects or whatever that has been propagated, it has been a boon that we have discovered many pharmaceutical drugs which are life-saving, which are altering the course of the disease in a very beautiful way. And of course, there have been side effects. And now the doctors who are prescribing them are also like judiciously doing it. So it is, but despite this, people were looking for an alternative thing, and they tried to go back to few other modalities like the alternative medicine. So what is alternative medicine and how do people perceive it? So most often people perceive it from what they get to read about either in their WhatsApp forwards or the Google or anything which the friends discuss and share. So alternative medicine is any practice that aims to achieve the healing effects of medicine despite lacking. So but there is no testability, repeatability, or evidence of effectiveness. So this is what the definition is given by in the Google. So according to them, like, because it can't be tested, repeated, or there is evidence of effectiveness, they try to label all these forms of practice as alternative medicine. But in 2009, they defined a traditional medicine as the sum total of knowledge, skill, and practices which are based on the theories, beliefs, and experiences of the indigenous cultures. So whichever the country or the state is practicing a particular method, like for example, Ayurveda from India, the traditional Chinese medicine, or if various countries have their own way of practicing, there were practices which kept on going from one generation to the other. So WHO tried to incorporate all these things and bring them under one platform. So which so then that is when the alternative medicine term became much popular. So what are all the alternative therapies that we know of? So there are so many things, like starting from meditation, yoga, especially in Indian population, all these are very popular forms of alternative therapies. So this creates even more confusion. So you have allopathy plus so many things. So now, even if somebody wants to explore an alternative therapy, they don't know like how to combine and which one to combine. So that again creates confusion, and people will come back now asking the allopathy doctors themselves, like, now, can I take up Ayurvedic medications? Can I try homeopathy? So this has been happening. So with the awareness, these kind of questions have become common. So when did all this start? Like, when did these therapies start becoming popular? So till 1970s, there wasn't much popularity or credit given for these. So slowly, it started beginning to rise in the West. So in India, of course, like we always had a lot of these homemade remedies, and all that was part of our thing, and it still continues to be part of our treatments for some simple cough, cold. None of us go to the doctors, none of us take medicines, and even being allopathic doctors, we don't take any antibiotics or any medications for simple ailments. So in the West, however, it was a different thing. So there was a new age movement which started in the 1960s and 70s. So why did this happen? Because a lot of people had this thing that they didn't want to use so many chemicals. There were side effects of drugs, so they kind of started feeling that we need something else or something better. And also there were cultural beliefs and practices. And with the rise in the population, so till 1960s and 70s, people were still like reeling with the aftermaths of world wars. So there was hardly any time for people to pay attention to all these things. So with the 1960s and 70s, there was sort of a stability, I would say, in the world itself, like, regarding, uh, like, they didn't have to face wars. They didn't have to, there were no major crises as such. So what happened is that, like, the attention was now more towards how the well-being, like, how we can achieve a good well-being. So with that, what happened is that people started paying attention to themselves, their health, and the focus of attention was to take care of the population. Like, people had got independence from their freedom struggles. The countries were, like, if you take India also, like, it was like now it had new agendas to concentrate on. So during this time, there were so many alternative medicines which came into popularity. So by 80s, even British Medical Journal said that, there are, apparently it made a quote saying that there are endless stream of books, articles, and, the whole media is bombarding the public about the virtues of alternative treatment. Yet, despite all this, like, despite the rising popularity of alternative medicines, despite that, there were brickbats. So why was this? What was the reason for it? So, like, now once the alternative medicine started being used, people started observing whether it was effective as compared. Obviously, there was comparison. Like, there was allopathic drugs, there were alternative medicines. So obviously, the effectiveness had to be compared. So what happened is, like, some uh, people, when they started researching about this, they realized that the effectiveness has not been established using scientific methods. So um, another thing is whether the pharma industry felt threatened. So that's another possibility, and we can't rule it out. So there are theories or practices which are directly contradicted by the scientific evidence or scientific principles used in biomedicine. So most of these alternative therapies, they go by uh, their theories and their beliefs and practices, which are so much foreign or so much in contradiction to the traditional allopathic medicine. So that doesn't mean that it had to be like discarded, but when something is not part of your system, not part of your curriculum, you always tend to feel that, okay, this is not good, this is not what I was taught, this is not what is the truth. So that's what happens. So apart from this, what happened is there were a lot of herbal supplements and drugs which were used in cancer therapy. So this happened in US. So which used to make the cancer drugs ineffective. So they found interactions, and there have been multiple studies. I did go through some of the journal articles which showed that the effectiveness of the chemotherapeutic drugs themselves was brought down by these herbal supplements, and they don't know the reason, like why. Maybe the constituents were like that. So that was one of the reasons. Then apart from this, drug interactions were also seen between these herbal supplements and warfarin. So warfarin is an anticoagulant which we all use in our valve replaced patients. So any patient that gets a mechanical valve, we usually put them on warfarin. These are anticoagulants to keep the blood thin so that it doesn't clot on the valves which we have replaced. So there was a noticed drug interaction. Then also some of the uh, US studies which studied the Ayurvedic medicines found that in 20% of the medications there were presence of heavy metals like lead, arsenic, and mercury. So that was one of the reasons. Like they extensively produced uh, research articles, so which are still there, like they're available as open access journals. And so then in the next phase, they started blaming these alternative therapies as some kind of quackademia or quackery. So quackery is not something which is like uh, which is like confined only to alternative streams. So quackery is something which exists in all the fields, and we have to be aware, like, how it shows up or how it is and how we need to deal with it. So it is not just one stream. So in most of the streams, this is how people will say, like, I have found a cure for this. I have found I am the best. When people start saying that, like my stream is the superior most, the other streams are of, worthless, or if they are saying such things, that is when, they are all red flags. A person who has to put down the other stream just because he has to say he is great is not the right, that's not the right attitude, neither is it the right way to go about it. So if somebody has given some therapy and some 2 or 3 patients feel benefited, that doesn't make it like, a study, isn't it? A study is when you test something or some theory or some kind of a healing modality or therapy on series of patients, like, and then document them and then say, okay, good sample size should be there, like, and then if you say that, yeah, I've come up with this difference, with this kind of, these many patients have found benefit in this particular drug or in this particular thing, then you can accept it. So we can't blindly accept what anybody says. So it is important, because now we have so many doctors, we have so many people who also are not doctors but are into healing. So we have to be aware that these kind of things are one of the ways to, like, identify whether a person is genuine or not. And as it is shown here, so, like, these are the kind of things which people use or say to appeal to the public that they are the best doctors, or they are doing the best, or they are coming up with the best treatment or strategies. So again, like, apart from this, they also, like, will be charging more. So obviously, if they have to say all this and use the media to communicate to the people, there would be expenditure, and obviously expenditure translates into money being taken from the patient. So, and it's also important that when people who are non-medicos, when they speak about the medical drugs or the medical things, you have to be a little cautious. So now this is what the last, this slide is all about. So here MD refers to the medicine, like, the basic MBBS degree. So if someone with no qualification, if they are speaking, that is wrong. And the new NMC guidelines, that is the National Medical Commission, has come up with the stringent guidelines saying that anybody who speaks to the media about any medical information which is wrong or anything, which he or she will be penalized. So alternative, so the person who is like, a non-medico who is speaking about these kind of things is definitely not the right approach. So apart from this, the bridbacks also, or the, like the quackery, the term quackery also came up because there were a lot of journalists who criticized the alternative medicine. So it was said that, it is a profitable industry, and that is the, the media is actually exploiting, and the people are getting exploited. So this is what the newspapers, journals started publishing. So it becomes quackery only when you recommend against the conventional therapies. So all alternative medicine cannot be claimed to be, quackery, just because, like, it doesn't agree with the mainstream curriculum. So when it advocates harmful therapies, or when it goes against the conventional therapies which are actually beneficial, that's when you need to take care about it. So another thing is that most of these advertisements which appeared in media and journals in the 80s and 90s used to have very, like the picture which is seen here, they show the backdrop of very nice leaves, fruits, and say that, it's all natural and hence not, harmful to the human body. So apart from this, the low level of scientific literacy among the population also, made them vulnerable. So during this time, there were genuine practitioners of alternative medicine. Along with that, there also have been a rise in the number of people who have been trying to use alternative medicine therapies to uh, make a vulnerable population, to encash the vulnerability of the population. So one more thing is the media, which comes up with various ads and without scrutinizing them, without knowing whether it is true or false. So many ads get played ad infinitum in most of the commercials. If you see, like they keep saying that this treatment is good for this, that treatment is good for that. So that's something which we have been exposed to from many years. And whenever these kind of things were questioned by uh, any doctors or allopathic practitioners or anybody, even like the alternative medicine people themselves, if they had questioned that, this is not the right, this thing, they were criticized severely. And we all know, like, how the lobbying works. So do these therapies actually work? So finally, we are coming to this thing that we have so many therapies, we have so many different modalities of therapies. So how accurate are they? How much do they actually work? So yes, no, can't say. So I would like a few answers here. How many of you feel that they work? How many of you feel that they don't work? And how many of you can say can't say? So please type in the chat box if possible. We'd like to see the number of replies for this. So next question is, do all of these therapies work? Yes? No? Or can't say? So my answer would be can't say, because I don't know, I have like looked through the various things, and I can't vouch that all of them work equally well. So some of them work really well. So we have seen the effects, we have experienced the effects, like for example, meditation. So that's one thing which works real wonders. So so what happened in the 80s and 90s is some of these alternative therapies were working well, and the results could not be ignored. So there were good positive results which came up. So the conventional medicine still could not accept it into its fold. So in the 80s and 90s, there was this struggle for supremacy, whether, allopathy would be supreme or the other alternative therapies would take over. So in this, there were few skeptics, like, who were not in favor of the alternative medicine, and they came up with some rational reasons saying why alternative therapies work. So how do they work? So they came up with some 4 or 5 important ways in which they work. So they said it is because the natural course of the disease. Yes, like if you say something like cold, cough, it'll have like a viral cold, or anything viral, it just has to complete its cycle and it'll just leave your body. So it's like, it stays for 1 week or 10 days at the max, and then it disappears from the system. So with or without therapy, you're going to get better, isn't it? So some small infection, some small boil anywhere, so it'll all tend to heal over a period of time. So they attributed, now the skeptics who didn't want the alternative medicine to flourish, they came up with this thing saying that it's all because of the natural course of the disease that the alternative therapies work. They don't work by themselves. They don't work based on that, based on their efficacy. Then the next thing they came up with was the placebo effect. So placebo effect was, of course, being tried even in the allopathic drugs. You have trials, randomized controlled trials, where placebos are administered to the patients, and they have seen some improvement because patient was convinced that he was getting the treatment and he became better. So the placebo effect was again extrapolated to the alternative therapies. Then came the nocebo effect. So here the individual is given the standard treatment, but he is convinced that the treatment doesn't work on him, and somehow the results don't show up. So this is called the nocebo effect, and it was also one of the things which was attributed to why the standard treatment didn't work on certain people and alternative therapies worked better. Then there was the no adverse effects. So what happened is that the standard treatment was being replaced with the alternative treatment. So patients were feeling improvement and there was no adverse effect. So they said this was all because of the drug interactions, which I earlier mentioned, and drug interference. So when the standard treatment is being interacting, there is drug interactions. So it brings down the efficacy of the regular drugs as well as the side effects come down. So they thought, or they said, the side effects which come down because of the use of these alternative therapies is because of the drug interaction. The efficacy of drugs is coming down at the cost of not having the side effect. So now what happened later on? Now is that slowly some of the people started showing interest and the curious ones started researching about it. So that's how you have various articles. These are all PubMed indexed articles, like, published in very good articles, very good journals. So they started actually like looking into what was happening. So meditation was one of the easiest things to study, easiest thing to maybe quantify, or I don't know, somehow. But the transcendental meditation, which was taken to the US by Maharshi Mahesh Yogi, they started with their own school where they started conducting experiments. They started giving out data. So somehow that made people inspired to start working on it. So that's how there were many journal articles which came up, and these are the recent ones if you see here. So even in 2022, and people are still researching about it, seeing the effects of it, and you have journals now which are called as evidence-based complementary and alternative medicine. So this is a journal which is dedicated for complementary and alternative medicine. So it has been a long journey for the alternative therapies. So it hasn't been an easy one, and it had to prove itself over and over. So with that, we get to know that meditation has so many benefits. Yoga has its own benefits, and then slowly, US woke up to it, woke up to all this which was happening, and it created a classification system. So first thing is it came up with the center, which could have all this complementary and alternative medicine together under one roof. So it came up with a National Center for Complementary and Integrated Health. So once this center came up, they started, because the population, about 35 to 40% of the population by the end of 2000 in US had started using alternative medicines. So 40% is a very significant population, and the US government could not ignore it. So it had to start integrating them. So they had to bring down a classification. They even classified, saying that you have something called the whole body medicine, like homeopathy, naturopathy, Ayurveda, and traditional Chinese ones. So you see the trend, or you see that, from being like, labeling alternative medicines as quackery, slowly the government moved towards accepting that into one fold, at least, like at least giving it the acknowledgement that it deserved. So they classified it into whole body medicine, mind body interventions, where you have cognitive behavioral therapy, meditation, all that comes under that. Then use of herbs was classified as biology based practices. Then you had reflexology, body, and acupressure and acupuncture coming under manipulative and body-based practices, and energy medicine. So we all know that all these are various modalities. So they tried to classify it and like document it, or like maybe they wanted to start studying them and see if how effective they are. So initially there were articles which said that as I mentioned, Ayurvedic drugs have heavy metals, then homeopathic drugs are like too diluted, because they try to give the same thing whichever causes the disease, the same substance in the most dilute form is used to treat. So they even labeled it as something, is that homeopathic medicines are nothing but water. So from there, you see that the trend changed. So in over the 2 decades, like in the 90s and 2000s, so this shift gradually happened. So what do your people feel? So in truth, actually, there is no such thing as conventional, alternative, complementary. It's only the medicine that works or doesn't work. For the patient, that's all what matters. He is not bothered whether you give him allopathy, you give him Ayurvedic, whatever. It doesn't matter. For him, he wants to take the medicine which works for him, and he has to find the relief. So now what is the way forward for us? So we are into allopathy, we are practicing allopathy day in and day out. So how do we take these things forward in the next generation? So one thing is, like, whenever patients come to us, I think it's very important that we have to, if the patient says whether he can use techniques like meditation, Reiki, yoga, or whatever, I think we should encourage them, so that in a way builds a very good doctor-patient relationship. It makes the patient feel that he or she is in safe hands. So it's important that they will obviously, like, during the times of distress, seek validation from us, because they want to know whether it is useful. They want to know whether it is is there some harmful effects if they use that, and you know and the allopathic drugs also they'll be taking. So they want to know whether it actually in any way harms them. So I think it's prudent to tell them that please explore meditation, yoga, or pranayam, because as far as I know, they don't have any side effects. Like, most of them are, like, very comfortable for patient to do. And when the patient wants, it's better to give it to him. Then do not put down other streams of medicine. See, because we are not exposed to, we have no idea what the Ayurvedic people are doing. We have no idea about what the homeopathic people are using drugs to treat. So without the knowledge about all the other streams, I think it's very important that we are in a responsible position where we should not be talking negatively about it unless we know entirely about all the systems, which I feel is difficult. So if patient wants to use some totally different therapy and which you are not convinced about or which you do not know about, so randomly patient comes and says, I want to try only homeopathic medicine for this. So then what do? Then the best thing to do is to talk to them about the condition, talk to them about the risks of not going ahead with the procedure or with the treatment, and then tell them that they have the free will to choose, because ultimately patient has to decide what he wants to take, whether allopathic or homeopathic or whatever. But you have to tell them that, like, not taking the medicine will lead to so and so risks. And the responsibility of this lies with the patient. So you have to make it clear to them that they are the responsibility of their health lies in their hands, and they will be the decision makers. And document the same in the OPD file or inpatient file, because it can be a medico-legal aspect. So being allopathic doctors, how much the consumer courts are, like, they love to sue the doctors, and we often read about so many litigations. So it is always safe to say that patient has asked for this, I have advised this, and patient has chosen to explore another alternative therapy, and document it so that you are safe in if somebody comes and sues you saying that you have not treated the patient, you have given the reason. So also help the patient in another way by giving him a time frame. So if a patient says, I want to try alternative medicine, I don't want this allopathic medicine at all, fine, give them a time frame, like a safe period. For example, if the patient is having severe stenotic blocks, I'm not going to tell him take 6 months time and explore your alternative therapies and then you can come back. So I'm going to tell him that, you can try for some time. If it is not showing any results, I would want you to come back to us. This is I think in a responsible way, you're allowing him to make decisions, and it will also actually increase the patient's faith in the doctor who says these kind of things, like, not discouraging them directly. So if you tell them, if anyway they are like very adamant about trying the other therapies, and if you're not convinced about these therapies, then I think it's better to give them a time frame and say that you have this much time frame, like within which time I think it's safer for you to come back, get investigated again, see what is happening, and then take a call whether you want to pursue it or not. So other end of the spectrum are the practicing healers or energy medicine persons. So they are into healing therapies, they are into various modalities. So how should they be dealing with these patients? Now, some patients, some small percentage of patients who have like, come out of the allopathic stream and they want to explore something else. So here, what I would suggest is, like, document and maintain records, one thing, so that when you follow up the patients, you know how your long-term result has been, what has worked for the patients, what has not worked. And maybe if you have a clinician friend, a doctor who is a friend, you can even analyze the data and come to good conclusions, so that it becomes a very good even something like a Reiki, if you have been doing and you have been following up patients, or see over a period of time, if you have been seeing them. So if you chat, or I mean, like, if you discuss the same cases with your doctor friends, definitely the amount of knowledge which you're going to get is going to be tremendous. So you'll understand how things work. So, and allow patients to consult their treating physician. This is very important, because a person who doesn't have an MBBS degree, when they are practicing healing sessions, it's important that, not feel egoistic and say that, no, my stream of therapy is the best and I want to go ahead with this. And, telling the patient that don't consult, don't go back to your allopathic doctors, they fleece you, I mean, we have heard all these stories in the OPD. If you sit in the OPD, you'll hear all kinds of stories. So that is how I have come up with all these kind of, things. So it is better, like, if as you're treating and as they see improvement also, it is good. If they're not seeing improvement and something else to be taken care of, that also can be taken care of. So any investigational follow-up that has to be done, encourage them to do it. So ultimately, it is a patient. It is not about which stream of medicine is better or which stream of therapy is better. So again, I would like to say, don't put down any other stream practitioners. So it's very important that either in allopathy or in the other streams, it's better not to criticize others, or because this is creating confusion in patients' mind. So they get exposed to so many alternative therapies. They don't know. They come to you, and then if you say this is the best modality, and, don't explore this, don't do that. So they become more insecure, more distrustful, and eventually there is non-compliance, or patient compliance comes down. He won't be able to even if whatever he is trying to take, like, whatever treatment he is trying to take, he may not be like responding in a proper way. So coming to the new policies, so the NMC, the National Medical Council, has come up with the idea that they want to introduce Ayurveda or yoga or meditation, all these topics, into the mainstream curriculum. It has not yet happened, but they are planning to. We had a teachers meet last week in the Nimans Convention Center. So there they told us that they are planning to introduce. So maybe with this, there will be more studies and research in a structured manner, so that we can integrate many streams into one, under one hospital or under one setup, so that there can be a patient who can avail different therapies under one roof. So that makes things easier. And also, when doctors and alternative practitioners, when they work together, and they'll understand what is best for the patient, what works well, how to combine therapies. It's something which it's a it's a new field, and we will start slowly learning how to utilize to the best utilize it in the best possible way for the patient. So eventually, it's not about which doctor is the best. It's ultimately what works best for the patient. So with this, thank you so much for your patient listening.
Interesting. Thank you, Dr. Chandana.
Dr. Ranjan, for this opportunity. So,
This discussion is highly needed. That
yeah, because
approach, yeah.
nobody talks about this. Nobody says, what are we supposed to tell our patients in the OPD? Nobody has taught us. And, it's like, it becomes difficult because we have to decide what to tell, how to communicate to the patient. So all these things are important.
Science is evolving field.
Yes.
Science update itself. So, as a optimist, I believe that science, mainstream science, as well as complementary alternative medical science, will improve. We need to cultivate scientific temperament. Alternative medicine practitioners. Now I also fall in the category of alternative medicine practitioner.
But you have the advantage of an MBBS degree, so
Yeah.
it's definitely good. You can combine very easily.
And but yes, what and this is picture taken by you, right?
Yes, yes.
Yeah. So friends, Dr. Chandana is also a photographer, and this is
The hobby.
her the real picture taken by this picture. So this bird is this is looking 90-degree turn is needed.
No, it's a nest. It's the sunbird's nest. So it's a bird which is like sitting there.
Okay. So whatever you are saying, Dr. Chandana, it's very right. It's very true. And that documentation is needed. We all need to be humble. Mainstream doctors as well as alternative practitioners. Sometimes alternative practitioners degrade mainstream when the news of side effect is out. And science is an evolving field.
Correct.
After COVID, mainstream doctors, mainstream medicine is also ready to accommodate importance of mental health, importance of complementary medicine. So with time, let's stay positive. Those who are alternative medicine practitioners here like me, and now I I keep myself in alternative practitioners only. I don't prescribe medicine in my practice. And in fact, I am doing live OPD on mass television. You are saying that in alternative medicine practice, there are lots of advertising opportunity. So it can fall in the category of advertisement, but it's mainly a social service. I do 1 hour show on Dr. Se Pucho with the name Dr. Se Pucho in Hindi language on a TV channel. One can call and one can ask the acupressure points and meditation and chakras and mudras and color therapy and music therapy. Detail, ideally, WHO recommends that a doctor should see only 10 new patients in a day. But that is not practiced in most of the government hospitals. Not possible. At least in India, context of India, it's not possible. So in the 1 hour duration, Friday 5 p.m. to 6 p.m. I do that. So I get 15 to 18 calls. So just by listening few words, I have to means we are thinking that should we increase the frequency instead of once a week. So I don't know. I want to know your opinion. What you will say as a mainstream practitioner? Should this happen or what? What is?
Definitely it should, because see, you have a very good advantage of being an MBBS graduate. So definitely, if you're seeing and noticing the effects, noticing the positive effects of all these things, I would definitely say, like, you should start documenting more and maybe do more studies, like involve people, whoever is there, whoever is working with you, like, try to publish these things as a data, because boy, we severely lack in publication. We don't publish our data, we don't put it up. So somewhere that when the data is not published or put up, there is no evidence. It's like it'll all fall under the something which doesn't have evidence. That's exactly what has been happening. So when people take up, like for example, if I talk about the pharmaceutical drugs, there are so many trials, like random control trials. There are so many trials which are done to make sure they tell the patient, I mean, to tell the public that it is safe and it can be cross-checked. Same thing, I strongly feel there should be a journal dedicated for these things. We should publish whatever we have noticed, whatever we have seen. I'm not saying that you need validation from some outside source. No, we are not looking for validation. We are not looking for a stamp of approval. No. But when you publish it in some open access journals, a lot of people can access it. A lot of people can know that there is really so much of thing happening. Otherwise, I wouldn't know what Dr. Ranjan is doing. Dr. Ranjan will not know what I am doing.
I agree with you up to some extent that yes, maintenance of data or record is needed, but on practical front, there are many things that one needs some scientific research mindset to document.
Correct.
A clinician and in a OPD, many doctors don't have that temperament. There's different department, biostatics, which falls in and in the field of research and journal, there is one interesting finding of Dr. Dean Ornish. After knowing about Dean Ornish's work, that
I was very impressed.
He has published his research work. Even the insurance company financed his lifestyle program after observing 17 years. See, since 90s, he's doing his lifestyle program. He's reversing coronary blockage, even of severe level, not just mild, not just moderate, but severe coronary blockage. And insurance company is financing his lifestyle program. Medicaid insurance services. In all medical journal, Lancet, BMJ, JAMA, American Journal of Cardiology, his research work is there. But what is the practical in medical community?
In medical community, I would like to say that very few are aware of this thing. So only when I became aware and when I started noticing, his articles and all that, I even attended that Zoom session where you had invited him as a guest lecturer for a guest lecture.
So, not Dr. Dean Ornish, but Dr. Joel Khan. Another preventive cardiologist.
Yes. So
who works on similar front.
So that was really beneficial. So those dietary modifications, I'm definitely advising people, when they say they don't want surgery, we can't force them. So I try to tell them dietary modifications. And
in Dr. Dean Ornish's model of lifestyle medicine, there are four parts. One is diet, another is stress reduction by meditation, another is movement, and the fourth component is love. That is the most important part, and which is also there while we have self-love. And on practical basis, self-love comes through meditation. The one when we meditate, it is an act of self-love that you are giving time to yourself.